Okay, so we are live with our very first International College of Dentists USA section, Take 10, which we're going to be doing every Wednesday of every month, the third Wednesday of every month. And we're going to be highlighting a fellow from around the country and checking in with them to see what's going on and, kind of trying to make up for some of the FaceTime that we all miss and love so much. So today is one of my most favorite humans in dentistry, and my very first guest, Mr. Kevin Earle. Kevin, thank you for joining us.
Thank you, Dr. Patel.
So I'm going to tell everyone a little bit about you, even though I know so many of us know and love you. Kevin led the Arizona Dental Association as its executive director for 11 years, from 2008 to 2019. And Kevin came with a background in healthcare regulation and was former executive director of the Arizona Board of Dental Examiners as well. And before that, he was over on the East Coast with us in New Jersey and was the executive director of the New Jersey Board of Dentistry. And has the trifecta of honorary fellowships, so the American College of Dentists, the Pierre Fauchard Academy, and our very own International College of Dentists, where he was inducted as an honourary fellow last year in San Francisco. That was a great celebration. Since his retirement from the Arizona Dental Association, Mr. Earle has joined Performance Partners and Virtual Support Solutions, a practice support organization serving independent entrepreneurial dentists. He's also part of the risk management team with the Professional Protector Plan, a professional liability insurance company serving the dental profession. Kevin has a BA in Public Affairs from George Washington University, an MBA from Rutgers, and an MPH with a concentration in health policy from Columbia University. So officially welcome, Kevin. Thank you again.
Thank you. It's great to be here.
So
on a hot and sunny day in Arizona, where it's 115 today.
Yeah, we saw that. It's been kind of baking where you are. Tell us how you've been, I guess, since San Francisco, especially now that the whole world has changed.
Well, it's been sort of a roller coaster. I announced my retirement about a year and a half before that. So the recruitment process for a new executive director, I've been replaced by a great guy, Sean Murphy, who came to us from the American Association of Orthodontists. Yep. He's now heading up the Arizona Dental Association. We had a bit of a clunky transition in January because our legislative session was starting. And I had to get the legislative program going before Sean arrived in early February. So I was still very active down at the Capitol. As we know, our legislative session got a little truncated. We were hopeful after about 4 attempts to get dental coverage under our Medicaid program for expectant mothers, and we were this close again, and then COVID happened. So we're disappointed, but we're going to keep pushing to make sure that we get that coverage, to make sure that we have a lot of healthy moms out there and healthy babies.
So that's a really big, kind of a really big thing. And of course, everything sort of ground to a halt with COVID. How are Arizona dentists now, from what you know?
Well, I was visiting with 2 dentists this afternoon. They are finding that their schedules are pretty busy. Yep. The challenges, of course, with PPE and the trying to navigate the uncomfortableness of having all that stuff on, but their schedules are filling up. There's a challenge looming ahead because around October is going to be 6 months from when all this all started. A lot of folks are having trouble getting those schedules filled. And what we've developed is an outsourced service so that we can step in where your own administrative staff may be limited, and we can make outbound calls, get folks on the schedule. We can handle call rollover services. It's a pretty unique operation, and we're serving about 90 or so practices right now. So we are expanding. We are actually in many states, including states on the East Coast. Okay. And we're very excited about the growth that we expect from it.
So tell me a little bit more about that. What exactly does that service do, and how do they kind of link up with what dentists have in place currently?
Well, we virtually are connected to your practice management system.
Okay.
And your telephone system, which most people have a voice over IP system. And and we are virtually connected so that when the phones are ringing, if we program it so that after the third ring, the call goes to our team. Our team knows which practice they're answering for. They have a whole protocol for responding. It's as if you have a virtual extension of your practice.
Wow.
The young dentist I was with this afternoon pulled up his own phone records and found that in the last month, 19% of his calls went unanswered.
Wow.
So we pick that up. We handle people live so that if someone needs to change an appointment because we're connected to your practice management system, we can make sure that person gets their appointment changed, or if they're calling for a new appointment, that we get them on the schedule, collect their insurance information. We get all the necessary information that your own dental team would be doing right there in your office.
Got it. And it sounds like a really good service as well. If, God forbid things start to shut down again, or if you're unable to go in, or someone that's supposed to go in can't, I mean, right? That's a really big concern for people.
Yes, absolutely. I mean, our data shows that when a telephone call goes to voicemail, 85% of the people don't leave a message. So we want to make sure that we're capturing those people. And given the losses that many dental practices have suffered being closed for these extended periods of time, we want to make sure that we retain those patients, get them back on the schedule again, and do the appropriate follow-up. We also work closely with our partner Dental Intel to be able to identify exactly patients that may have been presented with treatment plans and there hasn't been follow-up done, that we can make outbound calling to try to get those folks back into the practice. A lot of times when I first got involved with dentistry, they said, dentists know this world, but they oftentimes aren't paying much attention to what's happening behind their back or in the front office, or even in the whole world around them, or even internationally. And that's why I've always been an advocate for people to be involved in organized dentistry, because there are so many things that affect dental practices, and dentists need to be have the tools to be able to navigate those challenges.
Correct.
Privately, as a company now, we're focused on making sure that we are providing the kinds of services that people would get from the DSO model, but servicing those independent dentists in a way that gives them access to those services.
Got it. Seems like a really great service and a really awesome kind of thing to have. And like I said, especially in the crazy time we live in now, I know having to reschedule and then continuously reschedule about 3 months of patients was pretty impossible. And people calling in and emergency calls getting missed, and other people whose dentists honestly haven't even opened yet.
Yeah. We have another affiliated entity called US Dental Triage, which is focused on trying to identify patients who are looking for a dentist that may have an acute dental need, and to keep them out of the hospital emergency room and direct them to our dentists who can properly treat their dental need. With the COVID crisis being what it is, we want to make sure that those patients are staying out of the emergency room where they have potential exposure to COVID.
Got it.
So that's another related entity that we have that we're working on. So when people say I retired, I didn't really retire.
Well, we miss you tremendously in the organized dentistry world, and it's good that although we're all separated right now, that you actually haven't gone very far.
Yeah.
If anyone wants more information about all this, how do they find it, or how do they contact you?
We go to dentalvss.com. It's our website where almost all of those services are outlined there.
Got it. Dental VSS, the letter V, the letter S, the letter S.
Right. Virtual Support Solutions.
Got it. And for everyone watching, this is live right now being streamed, but we will put that website in the comments or in the description. So if you want to go and check that out, you can. I want to thank you for giving me 10 minutes of your time and kind of running through what's been going on out there. Like I said, the East Coast and all of organized dentistry misses you tremendously. And thank you for everything that you did in all of the years for all of us dentists. I know.
Thank you. I'm never far away.
And thank God for social media.
Yeah, that's for sure.
So our next Take 10 interview is going to be in September. It's going to be September 16th. And the person I'm checking in with is actually from New Jersey as well, Dr. Michael Saba, who I'm sure, Kevin, you know.
Yep.
And in 2 weeks, on September 2nd, we're going to have another one of our live 45-minute interviews. And that's going to be with Dr. Joseph Keenely, who's our incoming Secretary General of the ICD worldwide, on his second day on the job. And he's going to be sharing with us some upcoming goals and plans for ICD. So any last words for us, Kevin?
Live long and prosper. That's my words.
Thank you again for being with us, and have a
Thank
great
you.
night, everyone.
Okay. Bye-bye.